Hi, wish you all a very good day. It's supposed to say good morning, good afternoon, or night, but I don't know when you view it. So depending upon the time you view it, wish you all an excellent time. Hope you all are learning at the comforts of your house in your respective rooms. So that's where this also comes from. It comes recorded from my house. So let's understand, coming back to the topic precisely. The topic that we're going to learn today for all of you is the topic known as the alveolar bone. We all now know that there are four basic tissues of the periodontium, and of these four basic tissues, one is the investing tissue, or the tissue that covers the rest or the remaining three. The one that covers the remaining three is what is depicted as pink in this picture, and it's also known as the gingiva. On the other hand, there are three more tissues which are present within this tissue. Those three tissues, one is an integral part of the tooth, and it's known as the cementum, which forms the outer surface of the root coverage of the root. On the other hand, there are two more tissues. One is known as the alveolar bone. It's a bone, or it's an housing basically, which holds the tooth into its position. And then you have something called as a periodontal ligament, which connects the tooth to this bone. So there's a fiber link that connects this root to the root to the bone, and that's the periodontal ligament. So all these four tissues, that's the gingiva, the alveolar bone, the periodontal ligament, and the cementum on the root surface, comprise of a tissue known as the periodontium. And all four of them together, they do a main job of keeping the tooth in the patient's mouth and withstand all the masticatory forces. So out of those four tissues, today we'll start learning about something what we call is the alveolar bone. Now we all know bone is not something very new. We've probably been learning it ever since probably our kindergarten times. Or probably first standard, where you know something called as calcium, you know something called bone, everything. Okay, so this is just an expanded version of the same. And alveolar bone is a bit more typical type of a bone, which we all have to learn now as dentists, periodontists, and probably tomorrow as implant surgeons. So let's see what's alveolar bone. Okay, yeah, this is a little bit about me, yeah, and that's my clinic. Practice. Yeah. So let's understand the contents of this chapter. We'll have a small introduction about bone that we just had. Then we're going to have learning a little bit about how bone develops. We'll study a little bit of bone histology. Then the various bone cells, the osteocytes, osteoblasts, etc. How does a bone remodel? Certain changes happening in the bone as one ages. And then let's look at the clinical considerations. So coming to the basic understanding, we have to understand it's connective tissue, which is specialized tissue, which is mineralized. So it means that apart from the matrix, which is collagenous in nature, it also has got minerals, which are added onto it. So the bone basically acts as a storehouse of minerals in the human body. A long bone per se would look something like this. If you take your tibia, fibula, or humerus, etc., any of those long bones, they have something called as a head, and then there's a shaft. Okay, the end of the head, which probably forms a joint cavity, is known as the epiphysis, and then you have a plate, and then you have the canal. The nutrient canal in between is where all the blood vessels are there. That's also known as the bone marrow in the long bones. Okay, and then the shaft is also known as the diaphysis. So it's the periphery, the outer layer of the bone is what contains a lot of mineral. The central core, what we know as a nutrient canal, is basically where all the arteries, veins, blood supply, neuronal supply, everything are there. But it's a periphery that is what is going to hold up the bone and mineral, and that's what bears your forces. So what does a bone do in general? A bone in the human body does very simple functions. It's a mineralized supporting tissue. It forms a skeletal outline, so on which everything is laid down. So if you basically have what we call as a skeleton, and then your muscles are on top, you have the organs in the center. So that's what the bone does. It's a supporting tissue. Okay, it provides a framework for the bone marrow. It's exactly something like what we call as in a building. For when a building is being done, you have something called a scaffold or a pillar. Before the pillar is concretized, you have something called these iron girdles, right? So exactly that's what does the skeletal framework or the bone do. It's like the iron bars in a pillar, and then you have the concrete that's added onto it. Okay. Most important function of the bone is it's a reservoir of calcium ion. You have to understand that everything in the human body is controlled by the calcium ions. Your heartbeat, your muscle actions, your exchange of other ions in the human body, fluid movement, everything depends upon the calcium ion. And without calcium ion, nothing works. Okay. So the bone acts as a primary reservoir of calcium. So what it does when calcium is available, it takes up and stores the calcium. When the calcium is required, the body removes the calcium from the bone and gives it to the organs that require calcium. So it acts as a reservoir, intake as well as an outtake, something like a dam. Okay, so where you can store the water, you can let out the water, or you can take the water. Exactly, that's what the bone does. It's a reservoir. Apart from that, obviously, the bone does give attachment to the muscles. When you have the muscles and the ligament, etc., attached to the bone, only then there is something called a movement. Without the muscular attachment to the bone, bone cannot be moved or you cannot do any function. Okay, and then the bone undergoes something called as remodeling. Depending upon the kind of stimulus that is given to the bone, it undergoes remodeling. It can undergo formation. It can undergo something called as a resorption. That's what is the basic function of the bone. So how do we classify bone? Bone is classified in different manners. Developmentally, it can be either endochondral or intramembranous or origin. Endochondral is in the fetus, and as the bone grows till what we call as someone hits puberty and till the vertical and horizontal growth of an individual is over. Okay, the bone at the growing end between the epiphysis and the diaphysis, in between area, is a cartilage, and this cartilage keeps on expanding and then it keeps on adding mineral. So that's what is called as endochondral, means the ossification of the bone happens into a cartilage. On the other hand, there's something called an intramembranous. Most of the bone which is there in the head area, that's the skull as well as the facial skeletal, okay, is all what we call as an intramembrane. So you basically have a sheet or a membrane of collagen, and then this collagen sheet is then mineralized or demineralized. So that's what is known as what we call as an intramembranous ossification. Histologically, bone can be either known as compact or cancellous bone. Okay, compact bone is where you have the tuberculae which are very close to each other, very less blood supply, but completely compact and strong and tight bone. Whereas cancellous is more porous, something like your thermocol. Okay, so that's what happens. You have the buds, and then there's a cartilage, exactly what you see in the last image. The blue part is the cartilage. So as the cartilage expands, then you have the mineralization. That's how what we call as endochondral bone ossification takes place. Whereas an intramembranous ossification is where you have a sheet. In this sheet, you have the cells. These cells undergo what you call a differentiation, and then this differentiated cell line then keeps on adding the mineral. So that's why it's known as an intramembranous ossification. So your maxilla, majority of your mandible, everything, especially the alveolar processes of the jaw, everything is what we call as an intramembranous ossification type of a bone what we see. So how does the development of the alveolar process? We have to understand that coming to the development of the alveolar process, we have to understand the development of the tooth and the alveolar process is a twin activity. One doesn't happen out without the other. So what we see is when our patients, when we have people or when all of us are getting developed at the 6th week of intrauterine life, when you have the enamel organ forming, okay, as the enamel is, as the tooth starts getting formed, at the same time, there is a peripheral condensation of these cells. This peripheral condensation of the cell undergoes 3 different distinct layers. What are those 3 distinct layers? The part of the cell which is away from the enamel organ, completely away, starts forming the alveolar bone tubercle. The one which is very near to the enamel organ starts forming the dental papilla, and then this will undergo into what we call formation of what we call the dental pulp. Okay, and then on the other hand, something that's in between forms what we call as the periodontal ligament as well as the cementum on the outer surface. Alveolar bone per se starts forming only as the crown completion is over. So at the formation of the root, when the root starts to form, when the Hertwig's epithelial root sheath, when the enamel formation is complete and the Hertwig's epithelial root sheath start extending down, at the breakdown of the cells of the Hertz, as the Hertz cells start breaking down, the cells of the dental sac, or the dental follicle rather, sorry, not the sac, dental follicle, they differentiate into 3 different cell lines. The 3 cell lines being osteoblastic line, periodontal ligament cell line, fibroblast rather, and then the cementoblastic line. So as these 3 cell lines separate, the outermost start forming the alveolar bone. The innermost start forming the cementum on the root surface, whereas the one which is on the in between both of these starts from the periodontal ligament fibers. So that's how the alveolar bone formation starts. The formation of alveolar bone starts at the time of the development of the periodontal ligament. Okay, so all these three of them form together after the formation of the crown or the enamel formation is completed. Okay, so coming to the composition of bone, we all know now very clearly, bone is around inorganic percentage of around 65. Organic matter is very, very important. Please understand, the organic matrix is laid down, and this organic matrix undergoes mineralization, and so that's why we have what we call around 88 to 89% of the bone, which is collagen, which is type 1 collagen primarily. Okay, and then you have some non-collagenous proteins of the organic matter that includes bone protein, osteocalcin, osteonectin, etc. Okay, but just remember at undergraduate level, for your level, just remember there's one protein primarily, and that is what we call as type 1 collagen. The rest is 65% is inorganic, which is what we call as a hydroxylapatite form of the calcium phosphate molecule. So calcium phosphate is in the form of hydroxylapatite. So your calcium phosphate, which is hydrated, that's why it's known as what we call as a hydroxylapatite. If the calcium phosphate is not hydrated, then the bone would break down. It would just be what we call a chalk powder and not a chalk. Okay, so that's what is the difference between what we call hydroxylated calcium phosphate and non-hydroxylated calcium phosphate. So the hydroxylapatite, the mineral content of the bone, is what we call as a hydroxylapatite form of a crystal, exactly similar to the way we have dentine. Okay, the primary type of collagens include 1, 3, and 5. Just remember 1, that's important. Then you have other non-collagenous proteins in the bone, what is known as osteocalcin, osteopontin, osteonectin, and also bone protein. If you remember these, that's like excellent. Okay, the next is what is known as alveolar bone. What is alveolar bone? Now, when we look at the maxilla or the mandible, you all have done this histology or rather osteology, right? You all had your skulls of patients or cadaver skulls in your hands, and you see that the maxilla and mandible is very distinctly divided into two portions. Okay, now what are these two portions? Portion 1 is the part of the maxilla or mandible which houses the teeth. The part which houses the teeth, as you see here, okay, where the roots are, the bone in proximity to the root. Okay, so this height from here to here, or here if I show you it on this image, it's from here to here, as you see on the arrow. The part of the bone that houses the tooth is known as the alveolar bone proper. Okay, the bone anything beyond the apex of the tooth. So if this is the apex of the tooth, and the bone which is more than a millimeter or two beyond the apex of the teeth is known as the basal bone. So the part where the tooth is the alveolar bone proper, and that's what we have to understand. Alveolar bone is a part of the maxilla and mandible which houses the roots of the teeth. This alveolar bone is again further subdivided, which we'll learn subsequently as we go further. Just remember, alveolar bone is that part of the bone. By definition, alveolar bone is that part of the bone which houses the roots of the teeth in the maxilla and in the mandible. The bone beyond that is known as the basal bone. Okay, so exactly. So what does the alveolar bone contain? It contains the alveolar process and the basal bone. Okay, so if I have to show you a 3D image or what you call a CT scan of the alveolar bone, that's how it would appear. You see this, the tooth is taken out. You see this socket? This bone is this thin sheet of bone on the buccal here, and this decently thick piece of bone on the palatal side is what we call, till this part is the alveolar bone. The bone beyond this, apical to this line, is known as what we call as the basal bone. It's the same thing in the maxilla and same thing in the mandible. Secondly, what does the alveolar bone do? It does few things. Alveolar bone does very few things. Number 1, the most important thing, it holds the tooth in position during mastication. It's like a housing. So it's like, you know, if you put a bulb into a socket, how it does? The socket holds the bulb. It's exactly the same thing. So your alveolar bone is holding the tooth in position. It holds it firmly during mastication. Imagine if the alveolar housing was not holding the bone tooth in position, then the tooth would keep on wobbling, and that's when someone is trying to eat, the teeth keeps on moving and they cannot eat or grind the food. Second, it aids in movement. So we all know now how does orthodontic treatment occur. You will learn about this a bit more later in your third year and final year. The movement of the bone is what helps in movement of the teeth. Just remember this, you will learn in detail much later. Third, it adapts to occlusal forces. We have to understand that every tooth and every individual have got different types of masticatory or biting forces. So now, depending upon the kind of forces that I have or what I generate or what you generate, the alveolar bone undergoes modeling, and this modeling or remodeling is determined by the forces. So now, depending upon the kind of forces generated, that kind of alveolar bone is formed. We'll study about this as we go further. Obviously, it also does most important function, what we call as supplying the blood vessels to the periodontal ligament. You have to understand cementum doesn't have any blood supply. The periodontal ligament fibers do not have any blood supply. So the nutrition to both of these comes primarily from the alveolar bone. Apart from that, obviously, deciduous teeth, it also houses the permanent teeth as they're getting erupted into the oral cavity. And it guides the eruption of your secondary teeth or your permanent dentition. Okay. So now, how does it look histologically? Histologically, we use the word alveolar bone proper or laminate. Then we have the tramacular bone and compact. So let's see each of them one by one. Okay. Histologically, the bone per se is classified as cortical bone and alveolar bone proper. Okay, and then the cancellous bone. So what you see here in this image, this brown portion with these lines is known as alveolar bone proper. Then there's the peripheral bone. Bone at the periphery, or what we call a part which forms a basal bone, is known as what we call a cortical bone, or at the periphery. So for example, if you go back to this image here, yeah, this bone here, what we see here on the surface, okay, is a cortical bone, buccal cortical bone, palatal or lingual cortical bone. This portion, what you see on the inside of the wall, is known as alveolar bone proper. That's a part of the bone where your periodontal ligament fibers, are also known as the sharpest fibers that enter the bone, are interject. So if this is the inner wall of the socket and these are the periodontal ligament fibers, they lock in. The part of the fibers that lock into the bone is known as the sharpest fibers. So now what we are seeing is here, this intersection. This part of the bone which gives attachment to this periodontal ligament fibers is known as alveolar bone proper, and that's partly porous and partly cortical. Peripheral bone on the outer surface here or on the inner surface is completely what we call as cortical. And then in between these two, this piece of bone, what we see here now, this is cortical, this is the alveolar bone proper here. This is the outer peripheral bone. And then what we see here is this part of bone, which is present between the two cortices, is known as the cancellous bone. So that's what we have. This is what we call as the cancellous bone. The outer bone here is compact or cortical. In between is cancellous, and this is the alveolar bone proper. Okay, now how does it look histologically? We all know the structure now for years now, a standard Haversian system. Okay, whether it's a compact bone or cancellous bone, apart from the amount of blood supply or vessels, it looks standard, very similar. You have what we call as a central nutrient canal. Then you have circumferential cells of the bone known as osteocytes. These osteocytes are those cells which are resting within the substance of the bone. They are arranged in circular manners, also known as concentric lamellae, and the blood and the nutrition for these cells comes from basically the central canal, which carries the artery, vein, and the nerve. Okay. So in generally, 85% of the human bone is all cortical. The rest is all cancellous. Okay. Now, what is the difference between the main cancellous bone and cortical bone? Is the gap between the two Haversian system. Now, let's look at this picture. If this is what we call as a compact bone or cortical bone, you will see that the lamellae around these nutrient canals are very compactly arranged, and all the nutrient canals are packed or stacked together. Okay, it's like, for example, you're traveling somewhere for 10 days, you have only one bag. So what do? You stack all your items one on top of each other. That's how is a cortical bone. It's compressed, and you sit on your suitcase and lock it down so that it doesn't. So that's what is cortical bone. On the other hand, cancellous bone is more like sponge. Okay, so what it has a lot of porosities, very vascularized. The cancellous bone has got very high amount of blood supply. So when you get an injury, for example, you have an injury, it's a cancellous bone that heals much faster than the cortical bone because the blood supply and nutrition, etc., is much higher in the cancellous bone. So you can see here in this picture, the compact bone trabeculæ are much closely spaced, much tightly adherent to each other. Whereas in the cancellous bone, you'll see that you can see gaps. And these gaps are the ones which give what we call flexibility to the bone to withstand forces. So for example, if there's an impact, the compact bone would be more brittle and it will crack, whereas the cancellous bone can just compress up and take the load. So depending upon the area of the jaw, you have what we call as some areas compact, some areas cancellous. Okay, so the structure of the bone, as you all know, is known as osteon. Okay, that's nothing but one vessel, one artery, one vein surrounded by the entire cells of this one. They also have Haversian canals, also known as Haversian canal, central canal, and the Walkman canals is nothing but walk canal or the blood supply or the nutrition canal from one Haversian system to the other, known as the Walkman. So this is the Haversian canal. This is the osteon, all the osteocytes around it, and this is what we call as the Walkman's canal. Okay. Intraorally, apart from the buccal and the lingual bone and the buccal cortical plate, the palatal cortical plate, okay, and within of the socket, there's something called also known as interradicular bone and interdental bone. This is the interdental bone and this is the interradicular bone. Okay, usually the interdental as well as the interradicular bone are primarily cancellous. They're soft. So what happens is, for example, now you're eating something very, very hard. Okay, or something gets stuck between your teeth, you need the teeth to have some flexibility. Otherwise, this bone is cortical, it can break and then cause severe pain. So what the nature has done, it's made this bone, which is between two roots or between two adjacent teeth, to be much more softer. Okay, next we'll understand a word called as what we call as the bundle bone. And what is this bundle bone? Bundle bone is nothing but that part of the bone I was describing you. Let's come to this. Yeah. That part of the bone, it's a histological term, okay? It's that part of the bone which gives attachment to the periodontal ligament fibers. So if this is the bone and these are the periodontal ligament fibers, and the point where the periodontal ligament fibers insert into the bone is known as the bundle bone, okay? So histologically, it's known as bundle bone, okay? Radiologically, it is known as laminodura. So there are three terminologies to describe the same thing. One is alveolar bone proper. Alveolar bone proper is the entire patch of bone, alveolus, which gives attachment to the teeth. Bundle bone is where exactly the points, for example, in this area, there are fibers getting inserted along these lines, so that becomes a bundle bone proper. And if you see here on this radiograph now, you see this area, okay, is more radio opaque than the rest of the area. And this radio opaque area is known as what we call as the lamina dura. Radiographically, it is known as lamina dura. Clinically, it is known as alveolar bone proper. Histologically, it is known as the bundle bone. I hope you've understood now. All three mean the same, but when it is observed in three different manners. Okay. So histologically, also known as cribriform plate anatomically, radiologically known as lamina dura. So this bone, what we see here, this white or more radiopaque line is what we call as the lamina dura. In between is cancellous. Okay. And if you see the same thing histologically where the perial fibers insert, it's known as what we call as the bundle bone. Okay, and all three are the same. Okay, yeah. And this interdental bone, the bone between two roots, is also known as a sponge bone or interdental bone. Histologically, it's also known as what we call the cancellous bone or softer bone. Now, what are the cells of the bone? We all know enough. That's what happens. Okay, in the bone marrow, what we have, very simple, the mesenchymal cells or the native cells, which can divide into multiple forms. Okay, so bone marrow has got two types of cell lines. One is hematopoietic, that's from where all your blood cells are coming, and mesenchymal, where all the mesodermal cells are coming, muscle cells, bone cells, etc. Okay, now these cells will then divide into three parts: osteoblast. The same osteoblast, as it ages and rests within the bone, becomes osteocyte. And this osteocyte, if it is there present at the periphery of the bone, it's known as the bone lining cell. Whereas the osteoclast is primarily derived from the osteoclast progenitor cells, or also from the monocytes. Okay. So now, what is the osteoblast? Osteoblast is nothing but the most primary cell in the bone. Okay, the job of this osteocyte is to form the bone mineral, is to form what we call as the collagen structure of the bone and then the bone mineralization. So these are low columnar cuboidal cells with a centrally placed nuclei, highly protein synthetic. So if you examine them under the microscope, you'll see a lot of what we call as cytoplasm is full of ribosomes, full of protein synthetic granules, full of granules, and primarily a lot of DNA. The nucleus is very active. So that's what you see. It's a cell which is very, very active in protein synthesis, a lot of rough endoplasmic reticulosome. So that's what you would see in a protein synthetic osteoblast. And the job of this is to lay down the collagen matrix onto which mineralization is going to happen. Okay, so the first thing that the osteoblast does is forms the collagen matrix, primarily type 1 collagen. And once this is done, then it starts laying down the mineral. Okay, and as the mineral gets laid down, some of the cells of this osteoblastic lineage get locked. Okay, now for example, you have this cell here. It is first from the collagen fibril, and then after forming the collagen fibrils, what it does, it starts putting the minerals. As it starts putting the hydroxylapatite mineral around it, this cell gets locked. It cannot move anywhere now. Okay, and because it gets locked, then this cell, the one which gets locked, is known as what we call as the osteocyte. And the osteocyte is a living cell. It maintains the vitality of the bone in that particular area. And the most important characteristic of the osteoblast is it is what we call as got very high levels of alkaline phosphatase. Alkaline phosphatase is the enzyme which helps in mineralizing the collagen matrix. The osteocyte, which gets locked within, osteoblast rather, which gets locked within the formation of the bone, is known as the osteocyte. Okay. And then is the osteoclast. Osteoclast is primarily a cell which is desired. The job of this cell is to help in maintaining the bone. Now, we have to understand that the kind of stimulation that the bone undergoes, bone has to form in some area and resolve in some area. A damaged bone, for example, if I kept my, if I keep on pressing my finger against this probably bone here, okay, now the bone around this area due to continuous pressure undergoes inflammation, and this inflammatory bone or bone that is damaged, injured, etc., has to be removed, and a healthy bone has to lay down. So this functionality of maintaining the bone form and structure is the job of the osteoclast. So what does the osteoclast do? Every time there's an injury, trauma, or anything, the body says, okay, this part of the bone has become old, you remove this and you lay down the new bone. So the first job there that comes is that of the osteoclast. And the osteoclast is what we call as a multinucleated cell. Okay, why? This cell forms by fusion of multiple monocytes. So what happens if I have to form bones in some area or remove bones in a certain area? Like for example, the tooth has been removed, the socket has to heal. So the socket healing starts with what we call osteoclastic activity. So what does osteoclast do now? In the blood clot, after removing the tooth, the blood clot that fills has got monocytes. These monocytes come together on the bone surface. As they fuse together, they form the osteoclast on the bone cell. It's got a very characteristic feature, and that characteristic feature is known as what we call as a ruffled border. This ruffled border increases the surface area. So for example, if this is a cell and this is a surface and it has to remove the bone here, this ruffled border sits around like this and seals it off. It like creates a suction. And then at these ruffled borders, okay, at these ruffled borders here, the hydrogen ion, also known as what we call as, let me just put that picture for you. Yeah. At this ruffled border, hydrogen ion, also basically hydrochloric acid, is released, and this acid release starts removing the mineral. Okay, bone formation starts with what we call as the first laying down the collagen and then mineralization, whereas bone removal starts by first removal of the mineral and then the collagen is taken out. So that's what happens. So if I have to remove the bone in a particular area, the osteoclast would come and attach. And once it attaches, it seals it off at the periphery, three-dimensionally. Imagine all around. It's like a suction cup. Okay, and then this releases acids, primarily hydrogen ion. And this hydrogen ion, what it does, it removes the mineral from the collagen matrix. These are the collagen fibers now. It removes all the mineral. Once all the mineral is taken out, then what gets exposed are the collagen fibers. These collagen fibers are then taken out by the macrophages. So that's how the bone resorption happens. Okay. So that is the main function of the osteoclast. What the osteoclast does, primarily a multinuclear cell. It helps in, because the ruffled border, it can move from one area to the other. The area where it stays is known as the house shapes, lacunae. Okay, so it's got acidic, because it's got high hydrochloric acid or high amount of hydrogen ions known as hydrophobic cytoplasm. Okay, so the job is to maintain the form and function of the bone and remove the old bone and lay down the new young active bone. Apart from all these, there is something called the bone lining cells. These are resting cells. So for example, you have the arm, you have the fibula, or this one, and or the radius of the arm. Any cell on the periphery, okay, at the periosteal level is lined by resting cells. These resting cells are known as the bone lining cells. Okay, entire bone surface all through is covered by something called as the periosteum. Okay, the layer or the membrane that covers the bone on the outside is known as periosteum. It's like, for example, you take your mobile phone and get it laminated. This lamination is nothing but a periosteum. Okay, and what does periosteum do? It protects the bone, and very, very importantly, it's a very rich source of reparative activity. So every time there's an injury, the first thing that gets injured is periosteum, and that sends a signal to the rest of the body. See, this part of the bone is injured, I need to repair. So that's what is the periosteum doing. Whereas within the inside of the bone, that is, for example, if I have to show you this picture, yeah. Now, on the other hand, the inside of the bone, okay, let's go back to this picture here. Let's take you back to the long bone. Let me see. Yeah. Yeah. Now, if this is your bone, if this is the bone, then the inner side, this is a vessel, nutrient canal vessel area. The inner side of this bone is then covered by what we call as the endosteum. So the bone is covered at the outside, the periphery. The periphery of the bone is covered by periosteum, whereas the inside part of the bone is covered by what we call as the endosteum. Okay, and both of them are very, very important, especially when it comes to repairing a injured or a damaged bone. Okay, so what a periosteum does, it primarily gives the muscles and all the things attachment. It's nutritive. Basically, it gives a lot of source. It's a source of progenitor cells. So every time you have an injury, you need progenitor cells that can form and repair it. So that's what is the source of the periosteum. Okay, so just a bit to understand now, we now know that the bone has got membranous as well as endochondral bone histologically is what we call as cortical as well as cancellous. By development, it can be endochondral or what we call as the intramembrane ossification. Intraorally, the bone is classified as alveolar bone proper and then the basal bone. Okay, alveolar bone proper is present only when the teeth are present. The minute the tooth are out of the socket, the alveolar bone is gone. Okay, and what are the factors that governing bone remodeling? Basically, local factors, which age-related changes, functional requirements, and systemic factors, primarily parathormone and vitamin D levels. Okay, so what happens to the bone as we age? The amount of vascularity reduces. That's why we say when you're extracting teeth in elderly individuals, see that you extract them more gently because it takes longer time to heal. Okay, the rate at which the bone, so someone, if a 10-year-old boy has a fracture and an 80-year-old man has a fracture, the healing rates are different. Why? The metabolic activity of the bone is much lower in elderly individuals. Okay, you can read all of this. Those slides will be given. Okay, here is the most important thing what I have to tell you. Now, you will learn this today and you learn it as long as you're going to practice dentistry, and that's what happens. That's what we call as the alveolar bone dynamics. What does the word alveolar bone dynamics mean? We have to understand when you start seeing here in this slide here from 0 to 5. Okay, 0 is a figure where the tooth is present within the alveolar bone. Okay, there's a root which is present. What we see in 0 is just the crown, the root is there already. Figure 1, you can see the root there. The minute the tooth is out of the socket, minute the root is extracted or the tooth is taken out, what happens is this part of the alveolar bone undergoes what we call a resorptive process. Okay, so every time you remove a tooth, every time you extract a tooth, we have to understand you're leading to what we call, you're creating a process of alveolar bone resorption, also known as the residual ridge resorption, the term what you must have heard in prosthodontics. Okay, why? Because if you do not have the root, if you do not have the periodontal ligament, then what happens is the alveolar bone, this piece of the bone that's present here, this piece of bone here, when you do not have any periodontal ligament attachment, then the bone will undergo resorption because there is no stimulation. The presence of the tooth and the PDL means if this is a bone socket and this is the tooth, there's always a movement. So the bone keeps on forming and resorbing, continuously holding the shape. Now, if this root is out, there's no stimulation to the inner side. And because there's no stimulation to the inner side, then what we see here, the bone starts undergoing resorptive process. And that's what happens. And as the duration, as longer the patient is without the teeth, the longer or the higher is the amount of what we call as a resorption. This is what we call as the residual resorption or alveolar bone dynamics after the loss of the tooth or the root. Okay, and what is the sequence here? Okay, initially someone has lost a teeth and looks like this. At the end of probably 3 months after extraction, the bone looks something like this. And as the duration of edentulosum increases, you see that the maxilla has become extremely small, and so also the mandible. Okay, so what we see here is this part. Remember, this is the most important part of the bone that you will remember and treat for the rest of your life, and that's what we call as the bundle bone or the alveolar bone proper. So what happens here? In full dentition, if a patient is going to look something like this here, okay, as a patient loses teeth, probably 6 months or 1 year down the line after extraction of all the teeth, you see the changes that happen to the facial form. The bite rays collapse, the lips go in, the patient starts looking aged, the muscles start losing their tonicity, and if the edentulosum keeps on increasing, as the entire alveolar process keeps on going away, okay, the alveolar process is gone. What remains here is just the basal bone, and with that what happens is you see here how the patient looks more aged when patients do not have teeth or the anything replacing a tooth in the patient's mouth. Okay, same thing here. Someone loses the posterior teeth, that's what happens to them. You see, as long as the teeth are good in the mouth, the facial form, everything looks good. The minute the teeth are lost, the alveolar bone. Now, these are the teeth. This piece is the alveolar bone. Once the alveolar bone proper is gone, what you see is just part of the bone that remains here is the basal bone, and basal bone does not give to form and function, it just stays there. Okay, and maintains the continuity but does not do any function. And that's what leads to what we call as change in the facial form, muscle tonicity, gives a more aged look. That's why you see when you go to your third year clinics and prosthodontic, you see that the aged individuals more without teeth look more like this. Whereas when you go to an orthodontics or a perionormal department where you have patients with all the teeth, they look more like this. Okay, so understand the loss of teeth is very, very bad thing to happen, and that's why we have to do anything to save the teeth, and that's because you can then retain the entire alveolus, and you retain the alveolus, and then you can retain what we call as the patient's shape, form, and functionality. I hope you've understood this. So let's come back and just go back and do a small recap. Let's understand alveolar bone. Alveolar bone is a part of the maxilla and mandible, okay, which supports the teeth, okay, and holds them in position. Secondly, it's a part of the periodontium. It's a part of the 4 tissues of the periodontium, which are invested by the gingiva. So this gingiva is the outer covering, the investing tissue, whereas inside we have the alveolar bone, periodontal ligament, and the cementum. Okay, and then very importantly, it's also known by 3 different names. Okay, alveolar bone proper, bundle bone, and what we call as the lamina dura. Lamina dura is a radiographic terminology, bundle bone is histological terminology, and alveolar bone proper is what we call the clinical terminology. Okay, so I hope you've understood. So that's what we'll close. There are questions at the end of this class. Question number 1, what is alveolar bone, what is lamina dura, and what is bundle bone? So you need to answer that, type in your answers and send it across. Thank you so much, and happy learning from your home. Thank you.